Hello everyone. Welcome. Thank you so much for joining me. Since this is our very first session, I'd like to take. Hello everyone. Welcome. Thank you so much for joining me. Since this is our very first session, I'd like to take. Try it again. Hello everyone. Welcome. Thank you so much for joining me. Since this is our very first session, I'd like to take a moment to introduce myself. As you know, my name is Michelle Sun. I've been with Kaiser for 23 years. I wanted to thank you for choosing me as your doctor and for helping me grow along the way. I'm triple board certified in family medicine, obesity medicine, and lifestyle medicine. I also serve as a regional specialist in chronic fatigue syndrome. In addition, I also enjoy working with medical students periodically. It keeps me curious and remind me that learning never stops. Supporting your health is my top priority, but I also know that clinic visit can often feel rushed, and there isn't always enough time to explore the why behind your health or share the full context, the science, and the practical tools that can help you make confident decisions. That is why I plan to start regular Zoom Health Talk, a space where we can slow down, learn together, and dive deeper into topics that truly matter for long-term well-being. I like to think my job as both a gardener and a detective. Like a gardener, I help you plant and nurturing health habit so that health can grow naturally. And like a detective, I work with you to uncover what might be getting in the way of that growth. Just like a garden can always become more vibrant, we all have a room to strengthen our health and resilience. This is a learning journey for me as well. Medicine is constantly evolving, and no one knows everything. I believe that what truly matters is not perfection, but connection, curiosity, and partnership. I like what Viktor Frankl said. Who has a why to live can bear almost anyhow. My hope is that through these talks, you will gain a deeper understanding of your body, discover your why, and feel inspired to make positive choices for your health and your life. Before we begin, I wanted to emphasize that these sessions are for educational purpose only and not intend to diagnose or provide individual medical advice. And any case examples are de-identified and shared solely to illustrate key learning points. This series is independent of my daily clinical practice and reflects my personal commitment to connect, keep learning, and practice whole person care together with you. Okay, before further ado, let's dive into today's topic, blood pressure. Why we start here? Because blood pressure is one of the strongest predictors of stroke and heart disease, and also one of the most modifiable conditions. Like all the other chronic conditions, managing blood pressure well isn't about fear or denial. It's about understanding and empowerment. By making small, constant daily choices, we can dramatically improve our health trajectory. The American Heart Association released updated hypertension guidelines just a month ago. I have reviewed and listened to them multiple times, and I'm excited to share the most practical takeaways with you. Since this is such a broad topic, I planned 7 or even 8 sessions. Here is a quick outline. I think you can see it. And you can look and glance through it. If you have any burning questions, please email me. Just include Zoom talk blood pressure questions in your question subject line so I can find them easily. Before we talk about how to manage it, it's important to understand the basic concept and our body physiology behind the blood pressure. Because once we understand why it happens, the recommendations make much more sense. So what is the definition of blood pressure? What is a blood pressure? Blood pressure is simply the forces of a blood pushing against the wall of your arteries as your heart pumps. It's like water flowing through a garden hose. If the water pressure is too high, it strains the hose. The walls may wear down, crack, or even burst over time. In the same way, when blood pressure stays high, it puts extra stress on your artery, making them stiffer and more fragile, and increase your risk for heart attack, stroke, and kidney problems. On the other hand, when blood pressure is too low, there may not be enough flow to deliver oxygen and nutrients to your brain and vital organs, causing dizziness, fatigue, or even fainting. So just as a well-balanced water flow keeps a garden healthy, a balanced blood pressure keeps your body circulation strong and nourished. Let's understanding your artery walls. Our arteries like a flexible garden hose that carry blood from the heart to the rest of the body. Each artery wall has 3 layers. The inner lining, tunica intima, is a smooth, slippery surface like a Teflon that makes blood flow easily without friction. The middle layer is tunica media, made of elastic fiber and muscles, like a stretchy rubber of a hose that tightens or relaxes to control flow. Our outer layer, the tunica externa, a tough outer wrap that keeps the artery from burst, like the fabric around pressure hose. Why blood pressure matters? When blood pressure pushes too hard against these walls for too long, the inner lining gets scratched. A plaque can start to build up. The elastic fiber stiffen. The artery loses their spring. The muscle stays tight. The artery becomes narrow. Over time, this makes our heart work harder and silently damage your blood vessel. Managing blood pressure is like caring for your hose. Keep them from cracking, stiffening, and leaking. So your brain, your heart, your eyes, your kidneys, and the other organs stay well protected. Understanding your blood pressure numbers. Systolic pressure, the highest pressure in your artery when the heart squeezes to pump blood out. diastolic pressure, the lowest pressure when the heart relaxes between beats. Think of systolic as the push of the water when you turn on the faucet, and diastolic as resting pressure that remains inside the pipe even when the faucet is off. When you check blood pressure, you usually see three numbers. The top number is systolic pressure. This is the highest pressure in your artery when your heart squeezes to pump out blood. The bottom number is diastolic pressure. This is the lowest pressure when your heart relaxes between beats. The third number is the pulse, how many times your heart beats each minute. In our faucet picture, this is the rhythm of how often the faucet turns on and off. It's important because it shows not just the pressure in the system, but also how hard and how often your heart is working. What is a healthy blood pressure? A normal blood pressure is considered below 120/80 mmHg. The 2025 guideline emphasized this normal range and also recommend that for most adults, the treatment goal should be below 130/80. If you are always taking medication and if you are already taking medication and tolerate it well, aiming close to 100 mmHg systolically may provide additional protection for your heart, brain, and kidney, but only if it is safe for you. The key is the balance. You don't want to push blood pressure too low to cause dizziness, fainting sensations, and also increase your risk of falling. Treatment should always be individualized. The goal should be adjusted to fit you. Why is maintaining normal blood pressure important? Blood pressure is what keeps your blood moving, carrying oxygen and nutrients to every cell in your body. Without the right amount of pressure, your organ cannot work well as it should be. Your blood pressure stays too high. It's like a water pressure that's too strong in a pipe. It slowly wears down the vessel walls because even every organ depends on healthy blood vessels. The damage show up maybe in a different way. In the brain, it can cause a stroke or memory decline. In the eyes, it lead to vision problems or blindness. In the heart, it can lead to heart disease and heart failure. In the kidney, it can contribute to kidney disease or even kidney failure. In the reproductive system, it can cause sexual dysfunction. Sexual dysfunction often appears 3 to 5 years before the onset of a heart disease, such as angina, which is a chest pain, heart attack, or diagnosed coronary artery disease, and it making these signs early warning signs of a vascular problem. On the other side, when blood pressure is too low, especially when standing up, cause dizziness and fainting sensations, this is a condition called orthostatic hypotension. That is why we're aiming for a healthy middle zone, not too high, not too low, just right to keep your organs safe and functioning well for the long run. When is the best time to check blood pressure? Blood pressure is dynamic. It's not a single fixed number, but constantly changing with your emotions, activities, stress, sleep quality, and circadian rhythm. Normally, it's dropped at night by about 10 to 20% compared to daytime levels. If it doesn't drop or even rises at night, called nocturnal hypertension, this is a risk of heart disease, stroke, and kidney damage. That is why getting the right measurement is so important. A single clinical reading can be misleading. It's often higher due to anxiety, the white coat effect. Checking at home at different time of the day give a more accurate picture. If your readings seems getting higher, I usually suggest checking 1 to 2 times after you wake up, after lunch, or in the afternoon or before bedtime for 5 to 7 days to see the pattern. If you wake up at night to use the bathroom periodically, that's also a useful time to check. If you smoke or drink alcohol, take readings both before and 30 or 60 minutes after, since this can temporarily raise your blood pressure. Recently, I had a male patient in his 40s came in for routine checkup with blood pressure reading of a higher 140s, even after repeating it, and he never had blood pressure issues in the past. Later on, I discovered that he had smoked a cup of cigarette before his visit, though his chart said he quit years ago. And it was a good reminder that timing, habit, and context matters when interpreting blood pressure. Another patient is much older, reported dizziness after meals. When he started tracking his blood pressure, he noticed drop more than 20 millimercuries after eating, a condition called postprandial hypotension. This is more common in older adult and in people with high blood pressure on medications, diabetes, or nerve problems. A small dip, like 5 to 10 millimercury after eating, is normal, but a drop of 20 millimercury or even more with dizziness, blurry vision, or fainting deserves attention. High post-meal blood sugar can worsen this, straining circulation in the short term and damaging blood vessel in the long run, which makes blood pressure harder to control. So during exercise, your blood pressure naturally rises and then falls slightly below baseline as the blood vessel relaxes. And this is a healthy response. But if your blood pressure spikes too high during exercise or drops too low afterwards with the symptoms, further evaluation is needed. In summary, small fluctuations are normal, but large changes of about 20 millimercury or higher or change causes symptoms should be taken seriously and discussed with me or your doctor. The goal isn't to chase one perfect number, but to understand your personal blood pressure patterns and keep it within a healthy range over time. How to measure blood pressure accurately? All major guidelines emphasize an accurate diagnosis start with accurate measurement because blood pressure varies with the setting, stress, and the time of the day. Home monitoring gives the most reliable picture of your true patterns. There are 4 key categories to get it right. Before measurement, avoid smoking, caffeine, alcohol, or exercise about for 30 minutes. Empty your bladder beforehand. Avoid measuring right after a meal or when in severe pain or emotional stress. During measurement, sit quietly for at least 5 minutes. Sit with the back supported, feet flat on the ground, and the legs uncrossed. Support your arm so that the cuff is at a heart level. Don't talk, text, or move during the measurement. equipment and technique, use a validated upper arm cuff. And the cuff size should cover about 80% of the arm circumference. Take 2 readings 1 minute apart and record the average. Timing for comparison, measure at the same time each day can be helpful. For a clear pattern, record reading for 5 to 7 consecutive days. Keep a log. That can be very helpful. What devices are best for home use? Not all blood pressure monitors are created equal. Accurate really matters. I usually recommend using clinically validated upper arm monitor. It is accurate, easy to use at home, and it's cheaper. Some reliable options, including Amaron, is widely validated with models such as Amaron Platinum, Evolve, or 10 series. I have no affiliation with any of these companies. Some people don't like the squeezing sensations of the upper arm cuff, or their arm or cuff size make it harder to get a good fit. And in those cases, a validated wrist device can be a good alternative. The key is accuracy. And for wrist monitoring, the most important thing is to keep the cuff at your heart level. A simple tip is to rest your hand, cross your chest, and place 2 fingers on the opposite collarbones to line it up with your heart. The position helps improve reliabilities. Validated wrist device, and I listed over here. I never use any of those, and you definitely can give me your feedback. Wrist monitor can work well if used properly, but positioning is very important. Ambulatory blood pressure monitoring. More and more people have heard about it. And this is because it gives a much clearer and more accurate picture of your blood pressure throughout the day, including during sleep. Ambulatory blood pressure monitoring helps us to see how your blood pressure responds to different activities, your meal, the stress, rest period, much like a continuous glucose monitoring does for your blood sugar. It's one of the best tools for detecting patterns such as masked hypertension, which means normal blood pressure in the clinic and high blood pressure at home, or nocturnal hypertension when blood pressure rises at night. Unfortunately, our clinic doesn't currently provide this service. If you find local facility that offer this ambulatory blood pressure monitoring, please let me know. I'll be happy to review the result with you. Home device options. And so this is some of the home device options I find which can be helpful to measure multiple times a day. They are not a true ambulatory blood pressure monitoring device, but when readings are taken 3 to 4 times daily for about a week, they can provide valuable insight, similar to a short-term ambulatory studies. This is an FDA or an American Heart Association validated device. What determines your blood pressure? Blood pressure is also called arterial pressure, mainly depends on 2 key factors, your cardiac output and peripheral resistance. Cardiac output means how much blood your heart pumps out each minute. This is also determined by stroke volumes, the amount of blood ejected with each heartbeat. Your heart rate, how fast your heart beat. Stroke volume itself depends on myocardial contractilities, how strong your heart muscle squeezes, and vascular volumes, how much blood is available for heart to pump. So together, stroke volumes and heart rate decide how much blood is pushed into the artery every minute. Second, peripheral resistance, how narrow or stiff your blood vessels are. It depends on vascular structure, whether arteries are flexible or hardened, wide or narrow. Vascular function, how well your vessel relaxes or constricts in response to signals such as stress, hormone, or medications. In simple terms, if your heart pumps harder or faster, your blood pressure rises. If your blood vessels are stiff or narrows, your blood pressure rises. That's why managing blood pressure often means address both helping the heart work efficiently and helping the vessel stay relaxed and flexible. How vessel elasticities affect blood pressure. This graph shows the difference between young, flexible arteries and older or stiffer arteries. Older doesn't mean stiff. That's why I say or. When heart contract, which means systole, it sends a surge of blood into the aorta. In young or healthy arteries, the aorta stretches outward to absorb part of the surge. This prevents a sudden rise in blood pressure. When the heart relaxes diastole, the aorta recoils and pushes the stored blood forward, keeping blood flow smooth and maintaining steady pressure. This stretch and recoil motion is called the Windkessel effect. It's what helps protect the heart and organ by smoothing it out circulation. In older or stiff arteries, the aorta loses elasticity. It can't expand to cushion the systolic surge. Systolic pressure rises higher. If it can coil effectively during diastolic pressure falls lower. This results a widened pulse pressure, a large gap between systolic and diastolic numbers, which increases strain of the heart and accelerate damage to the brain, kidney, and eyes. Our goal is to keep blood vessel young and elastic. Good vessel flexibilities keep blood flow steady and pressure balanced, protecting the heart and organs. The good news is we can nurture our blood vessels through daily choices, healthy habit, stress management, and medical care when needed. Over the next few sessions, we'll explore how to preserve and even restore vascular elasticity. In a bigger picture, dynamic resilience and healthy aging. Blood pressure isn't just a number. It reflects how adaptable your body is to daily life. Healthy arteries expand and relax with each heartbeat, just as resilient body and mind adjust smoothly to change with the stress. As we age, resilience, both biologically and emotionally, tends to decline. Our vessels stiffen, our stress response becomes less flexible, and recovery takes longer. But the good news is that resilience can be trained and restored, just like muscle strength. Every positive habit, from nurturing food, regular movement, and restorative sleep, to emotional regulations and meaning, purpose of life, strengthen this dynamic system. When your vessels, heart, brain, nervous system stay flexible and responsive, you build a foundation for healthy blood pressure, sharpened cognitions, better mood, and longer vitality. So, we have a talk today about arteries and blood pressure. The deeper message is about keeping your whole system dynamic, adaptive, and resilience, the true hallmark of health at any age. Okay, I'll pause here for now. Thank you for staying curious. We'll keep the conversation going next time as we connect these ideas to practical ways of protecting your heart and overall wealth. Thank you.